because it's a disorder, there are a lot of things which cannot be controlled, which are not in your hand. Of course, we are going to talk about modifiable and non-modifiable factors, which are involved in diabetes mellitus. But what are the risk factors? Now, honestly, if someone is asking me, even today when my patients ask me, what is diabetes? What is the cause of diabetes? The major thing is like, it's the most asymptomatic and a silent kind of disorder you have. In most cases, you might not show any classical signs, neither you can show any particular pinpointed factor, leading to diabetes. But there are some factors, which definitely trigger the development of diabetes in your body. First is genetic. Researchers have proven that, if you have a genetic predisposition of developing diabetes, you are always at the risk of developing type 2 diabetes, majorly due to genetics. Now, researchers have also shown that people who have their first or second generation of people, having diabetes mellitus are at the risk of developing diabetes in their life sometime by around 38 to 40%. So genetic plays a very important role, and obviously, as I mentioned earlier, that it's a non-modifiable factor. You cannot modify your genetics by any chance. So this is something where you would always be at the risk if your parents or your grandparents have it. Lifestyle, obesity, of course, it's a major modifiable factor. People who don't manage their weight, who don't lead a very good food habit pattern, or people who are sleep deprived, or they are more into the processed foods or alcohol intake, etc. These all are modifiable factors, and your diabetes management, trust me, revolves around how well you manage your diet. So this is something which is definitely on my list of modifiable factors, where the first most important treatment any healthcare provider would suggest is a lifestyle modification plan. So it's something which is modifiable and definitely has to be considered before giving any treatment or suggesting any treatment for diabetes mellitus. Stress cannot be seen. Everyone has it. The thing is that your hormones, and because I mentioned earlier that diabetes is an endocrinological factor, where you have a lot of issues related to stress. People with higher amount of stress without its proper management are shown to be prone developing diabetes in future. So it's very important to make sure that if you have stress, you need to manage it, and if you don't have stress, that's good for you. Lack of physical activity, and another modifiable factor. People who don't ensure that they are at least contributing to around 150 minutes of total exercise regime per week are at a higher risk of developing diabetes, for the simple reason that insulin sensitivity is directly proportional to physical activity. If your insulin levels are up to the mark, you need to make sure that you need to complement your physical activity. It can be anything, because exercise is something which works on your mental level as well. So there is no thumb rule as in what to follow in terms of exercise, but definitely it has a direct connection with your insulin sensitivity. People who are physically active or may just contribute to around 40 to 45 minutes of total any form of workouts per day are at a lesser risk of either developing insulin resistance or diabetes. Faulty food habits, which overlaps with lifestyle factors and obesity as well. We are going to discuss about the foods, which will help. But yes, faulty food habit is primarily one of the leading reasons of not being able to control your sugar levels up to the mark. So it's very important to understand that faulty food habits needs to be corrected. Most of the factors I am talking about today, risk factors which are responsible for development of diabetes are modifiable factors. So definitely these all things can be converted to a healthy lifestyle and a healthy lifestyle management factors. And other metabolic issues, like PCOS, very common in females, and the primary reason of PCOS, sometimes females are more more prone to insulin resistance. It leads to, of course, infertility and other issues as well. So other metabolic factors are also involved in the progression of diabetes mellitus in the body, especially metabolic issues like PCOS.